Hello, my name is Taylor and I'm a nursing student at U of M. My clinical placement is at Heartland Healthcare Center and I'm going to present one of my patients to you. The patient I interview is an 88-year-old Caucasian male and a World War II veteran. He was married for 68 years and lost his wife a few weeks ago due to Alzheimer's. He was brought to Heartland in July of 2012 and was admitted with the chief complaint of a cerebral vascular accident and weakness on his left side. This patient has a present illness of pain in his legs while walking, weakness, stumbling, and a need for assistance with the activities of daily living and mobility. This patient is considered a poor historian. When asked about his past illnesses, the patient only presented a past illness of chickenpox, measles, post-traumatic stress disorder, and a stroke. Upon chart review, patient is reported to have an enlarged prostate, depression, hyperlipidemia, hypertension, weakness, macular degeneration, COPD, dementia, and is legally blind. This patient is all up to date on his immunizations and is allergic to penicillin and simvastatin. The patient reports that he was only hospitalized for his stroke. Upon chart review, patient is reported to have an appendectomy and cardiac surgery on his right eye. Currently, this patient is taking medications for hypertension, constipation, cholesterol, pain, anxiety, depression, and his enlarged prostate gland. Patient reports that he used to smoke 1 pack of cigarettes a day for 60 years and stopped after his stroke. He reports he used to drink beer at home occasionally. He now drinks 1 to 2 ounces of coffee a day and reports having good sleeping patterns. This patient is currently on a ground and pureed diet due to losing his dentures. This patient currently uses a walker, wheelchair, and leg brace for a foot drop to ambulate. Patient reports that he had 5 children, 3 boys and 2 girls. 2 are still alive today and come to visit him often. He also reports that he goes to church every Sunday. Patient reports that his father had Parkinson's disease and his mother had asthma. He also reports that his brother and sister had Huntington's disease and his daughter had breast cancer. Overall, the patient has been happy with his health over the past 4 to 5 days. He is only unsatisfied with his hearing aids not working and his speed of care, but he understands that the nurses are trying their best. He reports having a healthy appetite and denies any fevers, chills, or night sweats. He reports excessive fatigue but no trouble sleeping. For a review of systems, I chose to do a musculoskeletal assessment because of his left-sided weakness and inability to ambulate without assistive devices, and a neurological assessment because of his stroke. Patient denies any joint pain, swelling, or redness. He reports some trouble with his range of motion in his legs. Patient states that he uses a wheelchair to move around and states he doesn't need a lot of help, but seems to need more recently with moving. Patient reports that he has weakness on his left side and his legs occasionally locking up. He states that wearing a leg brace makes his legs feel better. Patient had full range of motion in his TMJ with elevation and depression. Full range of motion in his neck with rotation, flexion, and extension. Full range of motion in his right and left shoulders with abduction, adduction, circumduction, flexion, and extension. And full range of motion in his right and left elbow with flexion and extension. There was decreased flexion in his fingers, but normal extension, adduction, and abduction. Patient had a decreased range of motion in his wrist due to stiffness. Patient had full internal and external rotation of his right leg, but decreased external rotation of his left leg. His shoulder strength was rated 5 out of 5 bilaterally. His right biceps and triceps were graded a 5 out of 5. His left biceps and triceps were graded a 3 out of 5. His strength in his right wrist was a 4 out of 5, and his strength in his left was a 2 out of 5. His grip strength was graded a 4 out of 5 on the right and a 3 out of 5 on the left. His calf strengths and quadriceps were a 5 out of 5 bilaterally. His strength in his right ankle was graded a 4 out of 5, and his strength in his left ankle was graded a 2 out of 5. Hip and spinal assessments were deferred due to patient being in a wheelchair. Patient states that he has numbing, tingling, and weakness in his left leg. He denies having any seizures and reports that he has memory loss. He also reports having dizziness and loss of balance, and he states he staggers a lot while walking. He reports daily anxiety and stress a lot after his wife died, but company helps him feel better. He reports trouble with speech due to lost dentures and loss of hearing. Patient was alert and oriented to person, place, and time. He was able to recall 2 of the 3 items for his short-term memory recall test. For abstract reasoning, patient was able to spell the word world backwards. We could not assess intellectual ability due to patient not having his hearing aids in. When assessing his thought process, patient showed signs of decreased attention span. Assessing upper extremity fine motor was difficult to complete in fingers due to pain. Patient was also unable to perform heel to shin fine motor movement due to his legs locking up. Patient was able to perform finger to nose assessment with his right side, but difficulty with his left. We cannot assess light and painful sensation due to patient's inability to comprehend the assessment, but patient was able to discriminate between hot and cold temperatures. Also, the patient successfully demonstrated stereogenosis, graphesthesia, and proprioception bilaterally. The Romberg test and gross motor function, Babinski, and ankle clonus tests were deferred due to patient being in a wheelchair. The patient's blood pressure was 125/70, his pulse rate was 66, strong and regular, and his respiration rate was 12. Based on the history of this patient and having hypertension, I will also perform a cardiac assessment as a pertinent system. According to the American Journal of Hypertension, it is important to do a cardiac assessment because hypertension, which affects 1/3 of U.S. adults 20 years of age or older, is the most common risk factor for heart failure in the general population. The Framingham Heart Study, hypertension carried the greatest population attributable risk for heart failure for all risk factors, accounting for 39% of new heart failure cases in men and 59% in women. In a review including 200,000 hypertensive patients, heart failure development was more prevalent in older Black diabetic and very high cardiovascular risk individuals. Several trials have been demonstrated with antihypertensive treatment is highly effective in reducing risk of heart failure. I would also do a respiratory assessment as my second pertinent system. The patient has a history of COPD, and according to the International Journal of Chronic Obstructive Pulmonary Disease, COPD is a preventable and treatable disease with some significant extrapulmonary effects that may contribute to the severity in individual patients. Its pulmonary component is characterized by airflow limitation that is not fully reversible. The airflow limitation is usually progressive and associated with abnormal inflammatory response of the lungs to noxious particles or gases. Pathological changes in COPD are observed in central airways, small airways, and alveolar space. Because COPD deals with the lungs, I'll perform a respiratory assessment to examine the characteristics of COPD.